Hey guys, Dr. Kalaiko here, and
Hi, Sandra Medina.
our community program coordinator. We're here at Bakersfield College Delano campus for their Health Equity Summit. So getting involved, as a healthcare provider or healthcare worker in some of these events with local collaborators and other organizations is a great way for you to step outside the realm of your pharmacy or your clinic or wherever you work and get to know and network with these other stakeholders in your community. So today we're going to talk about different health equity issues like poverty and air quality and some of these more systemic issues that affect our community. So here we have Dr. Sonia Christian, the president of BC, who's introducing the HEAL Summit, which is the Health Equity Summit at Bakersfield College, and she's talking about the concepts that we're going to be discussing. So the conference includes panel discussions from researchers as well as healthcare professionals who work in the fields of substance use disorder, air quality, asthma, and other respiratory illnesses. And so really the point of this summit is to bring together stakeholders from different sectors, from healthcare to education to financial institutions that give loans to small businesses, to start to talk about some of the upstream social determinants of health. And we'll talk more about that concept in a later video. The panel, but my question is, how can we as a community begin to destigmatize behaviors like substance use disorder? Because when you talk about the breakdown of trust between patients and their doctors, I think a lot of times patients have this vibe from their providers, whether it's physicians, pharmacists, or others, that they're being judged for their behaviors, and I think that leads to a breakdown in communication. And especially when you talk about pregnant women and we're talking about low-income women of color, can you think of another group that's more judged and scrutinized? I'd be interested to hear your thoughts on stigma.
As a healthcare provider, I'm seeing all of the different angles with this. Stigma goes both ways. So, like you said, stigma actually, obviously harms the patient and the vulnerable population, but ultimately harms all of us because then we're spending a lot more resources trying to fix problems that could have been fixed if they were just sort of identified and treated upstream. So I think more education, certainly, but really just I think just being together in this room and thinking as a community is such a fresh source of inspiration just around issues of stigma. Through my work with the Bridge program, I actually was able to meet just very briefly the Surgeon General. And the Surgeon General left us with a very nice, I thought, inspiring quote. He said, "All of you are very smart, but you're not going to be productive unless you learn one thing. People don't really care what you know unless they know that you care." And to me, that really was very resonant. And I think about that, I go back to that quite a lot because I think a lot of the stigma that people have is just almost a defense mechanism that they just don't want to make themselves vulnerable, and they don't, as caregivers we often put up a shield, and our shield shows up as stigma just because we're afraid that whatever we do to help vulnerable populations will ultimately be futile. So I try to break down those barriers and talk about stigma in almost every talk that I give about opioids because it's such a prevalent barrier. But thank you very much for asking that question. I think it's something that we all need to think about all of these substances.